If you're pregnant and headlines about Tylenol and autism have made you anxious, you're not alone. Take a breath. Let's walk through what the science really says. The short answer is reassuring. When used as directed, acetaminophen remains the first-line over-the-counter option doctors recommend for pain and fever during pregnancy. Major medical organizations like ACOG, FDA, Autism Science Foundation have reviewed the research and have not found clear evidence that appropriate use of Tylenol causes autism or other neurodevelopmental conditions. So if Tylenol is the safest option, why is it suddenly making headlines? First, we need to understand the concept of correlation versus causation. Correlation, often called linkage or association, is when two things show up together. Causation means one thing makes the other happen. For example, ice cream sales and sunburns both rise in summer. They're linked. But ice cream doesn't cause sunburn. The sun does. Headlines often report correlations. They don't always prove cause and effect. You may have seen recent news suggesting links between prenatal acetaminophen and autism. Most of those reports come from observational studies. Observational research can show associations or correlation, but it cannot prove cause and effect. Think about this. Often the reason someone took the medicine, like infection or fever, could be the real driver of risk. In fact, a Swedish study of nearly 2.5 million children used sibling comparisons to account for genetics and family factors and found no evidence that acetaminophen causes neurodevelopmental problems. Autism is very complex, and it's misleading to boil autism's causes down to one simple thing. It arises from many factors working together. Genetics play the biggest role, with additional influences from the prenatal environment, for example, parental age, prematurity, or very low birth weight, and significant illness or fever during pregnancy. So why do doctors recommend acetaminophen? Because treating symptoms matter. High fever, especially in the first trimester, has been linked to an increased chance of miscarriage and some birth defects. Also, chronic pain can cause stress, which can affect fetal growth and preterm labor risk. Acetaminophen remains the best medication to manage these symptoms safely during pregnancy. Thoughtful treatment supports both you and your baby. The goal is comfort and safety, not more medication, just smart use when you need it. What about other pain relievers? Medicines like ibuprofen or naproxen carry risks later in pregnancy, which is why they're often avoided after about 20 weeks, unless your doctor specifically recommends them. If you have questions about any medicine, dosages, combinations, or what to take for specific symptoms, reach out to your provider. They're committed to helping you make personalized, evidence-based, and informed choices with confidence.